Okay, as Lucilla said, my name is Maryan Zirkle. I see some familiar faces, but I am a program officer at PCORI. If you don't know me or haven't heard me on a call or something when you've been working with Lucilla, I manage pSCANNER, as she said, but also the other clinical data research networks that are involved in PCORnet and sort of the data aspects that our coordinating center works on, and then also methods projects that have to do with big data research networks and distributed analytics. So I'll get started. I want to first state that I'm not a Wizard of Oz fanatic or anything, but when I talk with Lucilla about what we might discuss here and thought about all the questions that I get when I go speak at conferences or just go to conferences about the things that I assume people know, I started thinking, okay, PCOR, PCORI, PCORnet, and I thought, oh my, that no wonder everyone gets confused, because unless you come from a federal government agency and everything you do and everything you say has to do with acronyms, this can be really confusing and to understand what we're talking about. So today I'm just going to talk a little bit about the PCOR Trust Fund that basically is funding PCORI, which is the Patient-Centered Outcomes Research Institute. I'll talk to you a little bit about the institute where I work, the type of funding and research that we have, and some opportunities that are out there that might align with networks such as pSCANNER, and then PCORnet, of course, because that's the work that I do. So again, I'll try to keep it interesting because this is a bit of a long talk. I thought, again, the Yellow Brick Road seemed to fit right in because those that have been involved in PCORnet or PCORI, I guess, I've been there for 2 years. It's not a linear process in any way. We do a lot of winding and moving around and trying to go towards the best things. I think we're doing a really good job. We are all going towards something and we're moving quite fast. So it seemed to fit well. So again, I'll start out. So the Patient-Centered Outcomes Research Trust Fund funds the Patient-Centered Outcomes Research Institute. It was established by Congress through Patient Protection and Affordable Care Act of 2010 and receives income from 3 funding streams, and that's the Treasury, the CMS, and the PCOR fee. Now, who and what is funded? Basically, 80% of the funds from these 3 streams go to PCORI for research funding and operations. But 20% go to the Department of Health and Human Services, majority AHRQ, for dissemination and research capacity building. And this seems pretty simple, but this has been something that's really hard for, I think, people to get. How are we doing this, and where's it all going? Now, PCORI, again, this is not a government institute. We are an independent research institute. We're governed by a 21-member board representing the entire healthcare community. For those of you who have received rewards or attempted to receive awards for PCORI, our Board of Governor meetings are public, and that's where you find out whether or not you were awarded. You can take a look on the website. You can always go in and listen, and anyone can listen. PCORI funds comparative clinical effectiveness research, which we term CER. You'll hear that a lot. They engage patients and other stakeholders throughout the research process, and they seek answers to real-world questions. And you can basically say that patients are true north at PCORI. So basically, in a nutshell, PCORI is research guided by patients, caregivers, and the broader healthcare community. That's sort of what you want to come away with. We have 3 main goals: increase quantity, quality, and timeliness of useful, trustworthy research information available to support informed decisions. We want to speed the implementation and use of patient-centered outcomes research evidence, and we want to influence research funded by others to be more patient-centered. So what makes us different? There's a few things, but again, the takeaways are we fund research on which care options work, for whom, and under which circumstances. We focus on answering questions most important to patients and those who care for them. And we aim to produce evidence that can be easily applied in real-world settings. And we engage patients, caregivers, clinicians, insurers, employers, and other stakeholders throughout the entire process. So who are our stakeholders? We have a bunch. And as you might imagine, it is a lot of effort to engage all of these different stakeholders. So we have a few ways that we do this. We have merit review panels, speakers bureau, advisory panels, ambassadors, webinars, workshops. I'm going to talk to you a little bit about the engagement awards because I think these are things that sort of get kind of swept to the side. People don't really know they exist. And for networks out there, in particular our CDRNs, it's a supplemental funding, a way to supplement, I should say, your funding for engagement. So we have 4 awards that are currently available under the Eugene Washington PCORI Engagement Awards. These awards are up to $250,000 per project and up to 2 years in duration. The first is the Knowledge Awards, which increase knowledge about how consumers and healthcare information, view, receive, and make use of PCOR and CER. Training and Development Awards that build capacity for participating in PCOR and CER and create ways to connect patients, caregivers, clinicians, and other healthcare stakeholders within the research community. The Dissemination Awards, they develop and strengthen channels for disseminating and implementing PCOR and CER findings. And the Meeting and Conference Support Awards, which provide organizations with funding for meetings and conferences that align with PCORI's mission. Again, this is something that some of the other CDRNs have taken advantage of. So basically, as I said, we fund comparative clinical effectiveness research. What does that mean? So this is research that generates and synthesizes evidence comparing benefits and harms of at least 2 different methods to prevent, diagnose, treat, and monitor a clinical condition or improve care delivery. Research that measures benefits in real world, as I said, and research that informs a specific clinical or policy decision. It is also research that describes results in subgroups of people, research that applies appropriate methods and data sources, and research that helps consumers, clinicians, purchasers, and policymakers make informed decisions that will improve care for individuals and populations. Of note, we do not fund cost-effectiveness research as per our mandate. So this is another area where it gets kind of tricky and I get a lot of questions. We have national priorities for research. Now, each one of these that I'm going to talk about is actually a department within PCORI. They each have their own program officers, just like I work for infrastructure and methods with the PCORnet network. And so when I go through these things, if you have ideas or even thoughts about how you might request or apply for research in this area, you're more than happy to reach out to program officers listed on our website that work in this department, or me, and I will get you to someone in this department. So the first is assessment of prevention, diagnosis, and treatment options. This is research that compares the effectiveness and safety of alternative prevention, diagnosis, and treatment options. It determines which ones work best for different people with a particular health problem. The next is improving healthcare systems. And this is research that compares health system level approaches to improving access. Again, another one that could be really well aligned with the PCORnet network affiliates. Supports patient self-care, innovative use of health information technology, care coordination for complex conditions, and effective workforce deployment. Our communication and dissemination research priority is research on providing information produced by CER, empowering people to ask for and use the information, and supporting shared decision-making between patients and their providers. We have a national priority for research on addressing disparities. This is research on prevention, diagnosis, or treatment effectiveness, preferred clinical outcomes across patient populations, and healthcare required to achieve best outcomes in each population. We actually have 2 of our CDRNs from phase 1 that are working on an award in this area right now. Lastly, we have our national priority for research on accelerating patient-centered outcomes research and methodological research. This is where PCORnet falls in. This is research on building data infrastructure, improving analytic methods, and training researchers, patients, and other stakeholders to participate in this research. So, okay, this is what I consider PCORI's magic slippers, ruby red slippers, however you want to call it, special sauce. So our patient-centeredness and patient and stakeholder engagement is like no other. This is what we do. And I often get, what do you mean? How do we do that? How do we write that on a proposal? So patient-centeredness surrounds the project aims, answering questions or examining outcomes that matter to patients within the context of patient preferences. The research questions and outcomes should reflect what is important to patients and caregivers. Now, patient and stakeholder engagement is the patients being and partners in research being engaged, not as subjects, but again as partners. So it's active and meaningful engagement between scientists, patients, and other stakeholders, and it's community, patient, and caregiver involvement already in existent or well thought out plan within your proposal. And again, when proposals come in, if this is a misunderstanding, we often work with them to clarify what we mean and what the differences are. So to go a little bit further, if you think about all of those national priorities that I mentioned, within that, we fund research that focuses on high priority conditions. These are affecting large numbers of people across a range of populations, placing a heavy burden on individuals, families, specific populations in society, and including rare diseases, which are difficult to study. This is why we had rare disease cohorts built into our PCORnet network affiliates, CDRNs. We fund research that pays particular attention to specific populations. And you'll see a lot of this come out in several of our networks. And for instance, we have older adults, women, veterans, which, as Lucilla mentioned, obviously pSCANNER is bringing in the largest amount of veteran population of any network with the Vinci database. We fund research that targets specific high priority topics. This is a long list. You can see that, let's see, about 2 of them are projects administered by the NIH, so we work closely with them. And then we also have a project that's administered by the AHRQ. We're building and building and building always our collaborations with the other funding institutions. In addition to this list that's ongoing, I believe it was yesterday, PCORI posted, I think it's, 4 new funding opportunities that are targeted. They are around long-term opioid use for chronic pain, treatments of MS, studies in the area of treatment-resistant depression, and then also studies in the area of new oral anticoagulants. So again, this just got posted on our website, so I wanted to let everyone know. I'm quite sure you don't go there daily to find out what new and innovative ways we have for funding, but it is something to think about it if you're considering applying for research studies. So this is something that I will talk a little bit more about later for some funding opportunities, but as you know, we also work to improve research methodology at PCORI. As far as we're concerned in any study, obviously methods matter. And so we've developed methodology standards that patient-centered CER should follow at a minimum. So if you apply to PCORI, there are these 11 broad categories. You can see that if you were a network applying, obviously there's several that pertain to you. And if applicable, you are expected to respond that you are following the standards as set forth by PCORI. So as of the 28th, we actually have 468 projects funded in all of PCORI right now. We have over $1 billion awarded at this time, and we are in 41 states. So we're doing pretty well. Again, this is what I was sort of alluding to earlier. This is our PCORI funding opportunity page. And I would urge you to go to this page, and where you see the upcoming tab, if you click on that, as of yesterday, they listed a bunch of new opportunities that will be coming out, those 4 I just listed, in addition to the new Improving Methods PFA will be released as well, and they'll all be released on October 12th, or open for you to look at the PFA and then submit your LOI and or application, whatever is applicable. So I said I was going to talk a little bit more about the methods program. Again, this is a portion of my department, and I'm lucky enough to be able to manage about, I think, 6 studies right now, dealing with a variety of different things. Overall, our entire portfolio on methods has 73 funded projects right now at about $71 million awarded, and we're in 24 states, DC and Quebec. Our current portfolio is research on methods to, research related to patient and stakeholder engagement in the research process, patient-centered and patient-reported outcomes, human subjects protection, again, study design, analytic methods, and then data research networks. And I don't know if all of our networks within PCORnet are aware of the opportunities here. I mean, you'll see when I jump into PCORnet talk that there have been a lot of struggles, there's been a lot of lessons learned, and things that could possibly take us on another one of those yellow brick roads that would be interesting for some of our networks to study. And these are opportunities to do so. So again, this is a little bit more detail on what you'll find if you go look on the website. Like I said, October 12th, there will be a new PFA released. To my knowledge, it will look very much similar to the one that was in cycle 2. This will be cycle 3. You can see the previous announcements and take a look. These are all the areas of interest that we will be funding. So again, I always encourage people to take a look at our website because it helps you get ahead a little bit because our turnaround times are quite short. Now, so after talking about PCORI, obviously you can see that we do research differently for a lot of different reasons. Obviously, patient-centeredness, patient engagement, our focus on CER and PCOR in general. So if that's the case, that's research done differently, obviously PCORnet is research infrastructure done differently. And this is one of the taglines that we say all the time, but it actually means a lot. There's a lot in there. But PCORnet brings together the expertise, the populations, resources, and data of its participating organizations to create a national infrastructure that enables more efficient, patient-centered research. And it is just that. So you can see that we had in phase 1, 11 CDRNs, more than 70 participating health systems within that. We had Portal, LACDRN, PedsNet, PATH. Some of these you may know about if you're a member of pSCANNER. I'm quite sure you've worked with the other groups because I know, as Lucilla said, not only with the PPRNs are they collaborative here at pSCANNER, but with every other network in PCORnet. And PPRNs, we had 18 in phase 1, and that was a combination of 80 different organizations. Again, this information's all on PCORnet.org. So, if you aren't speed readers, and obviously this is kind of loaded slides, so I don't want you to have to waste your time looking through that, but you can learn more about each one of the organizations and the networks at PCORnet.org. So, again, when I was speaking with Lucilla what to talk about, we thought that past, present, and future sounded like a really good thing. We're always looking to solidify our vision at PCORI for PCORnet. And for me, I felt like, here we go again. It's a little bit more of the Wizard of Oz. So we have, leading experts in PCORnet across the entire nation. We have so much heart. It's unbelievable. The amount of passion that goes into the work that is done at must be unreasonable hours of the night because I don't know how they do it. And just the determination and the boldness of the participants at all levels in this network is amazing, and it continues. It's been 18 months, and I'm quite sure it's going to go into the next 3 years. So when I thought about how do you look at phase 1 and sort of summarize it, to look back or evaluate whether we did what we were supposed to do or what we wanted to do in the end. And in my mind, there were sort of research readiness, not for each individual network per se, but for the network as a whole is what was important to me. And if you can break that down based on technical infrastructure, clinical trial infrastructure, administrative simplicity, and people power. So I'm going to go through all 4 of those things and sort of just let you know what stuck out in my mind that brought us more towards that, what opportunities it gave us, and how we're evaluating it as we move forward. So, technical data infrastructure. As Lucilla said, there's more than 1 million patients involved in each network. As she said, they have 30 million or more. But at this point, every one of our CDRNs have transformed greater than 1 million patients into the PCORnet Common Data Model. Now, that took a lot of time and a lot of effort, but it also then gave us the opportunity to work toward optimizing processes for obtaining complete data. And this means administrative claims data, but also patient-reported outcomes, any other supplementary data that you can use to complete the patient picture. Now, in order to test this technical data infrastructure, we have our obesity demonstration projects. And again, I just, very high level going into this, we have 2 obesity projects, the bariatric study, and then effects of antibiotics on childhood growth. These are the CDRNs and PPRNs that are involved in each. For the bariatric study, we're looking to compare 3 bariatric surgical procedures. Our outcomes measured will be changes in BMI at years 1, 3, and 5, obesity-related outcomes for resolution of type 2 diabetes and incidence or recurrence of type 2 diabetes, and then adverse outcomes will be hospitalization, reoperation, and death. And then for the short and long-term effects of antibiotics on childhood growth, we'll be comparing effectiveness of different antibiotics used during the first 2 years of life, and also evaluating the comparative effectiveness of different types and amount of antibiotics used in the first 2 years of life on the rates and patterns of childhood growth during the first 5 years of life. So the outcomes measured there will be body mass index at ages 5 and 10 and growth trajectory for height and weight through preschool ages. So as I said, that's the work that we'll do to test our data infrastructure. So what about our clinical trial infrastructure? All phase 1 CDRNs are building the capacity to embed clinical trials into the clinical care workflow without disruption. Now, this provided for the opportunity for innovative techniques to leverage electronic health data, streamline consent and contracting, and reduce burden on providers. And we will be testing this with a clinical trial demonstration project. This is our adaptable trial. Again, I don't know if you all have heard about it. It's all over our webpage if you'd like to learn more. But the gist of it is basically it is a comparative effectiveness of 81 versus 325 milligrams of aspirin for secondary prevention of cardiac events and serious bleeding. And it's led by Dr. Rowe and Dr. Hernandez from Duke. Now, the third thing I mentioned was administrative simplicity. So all phase 1 CDRNs are streamlining their IRB processes, as Lucilla mentioned, and most are using the vehicle of reliance agreements. And this is an opportunity for us to make ourselves more attractive to external funders as a network and become a major success for PCORnet. At this current time, we are developing PCORnet-wide policies and a PCORnet master contract, and these will also be tested on these demonstration projects I just mentioned, the 2 obesity and the clinical trial. Now, last but certainly not least is the people power and transforming clinical research through PPRNs. So our PPRNs, as I said, 18 in the first phase, represent 18 different models of partnerships and levels of infrastructure. And they also represent over 100 diseases overall. Now, the PPRNs provided an enormous wealth of opportunities, but I will say, in my opinion, one of the greatest things has been the collaborations across PCORnet. And I'll also mention that in talking to Lucilla one time, at the very beginning, we were thinking about how can we work these collaborations between the PPRNs and the CDRNs. And it was a struggle for a lot of the PIs for the CDRNs, not because they couldn't figure out what they wanted to do, but how and when would we have the time, because we were keeping them pretty busy. But I remember a comment Lucilla made about the fact that, of course we want to work with the PPRNs. They're our gateway to all of these patient-reported outcomes. And it's exactly the truth. We have PPRN demonstration projects where we're going to try and demonstrate just how much information we can get from these the PPRNs, their patients, their communities, and really harvest that data and that knowledge. So our PPRN demonstration projects, they're pretty new. I'd be surprised if people knew, other than Mitch, who I can't find in the audience. But so PCORI is investing in supporting communities or networks of patients motivated to participate in clinical research through PCORnet and to develop their capacity to govern the research activities of their network. We are going to fund up to 8 individual projects The application deadline is today. And we will award up to $2.5 million for up to 3 years. And all the phase 2 PPRNs were invited to submit LOIs for this one. The other demonstrations projects started prior to phase 2, quite a bit prior. So that isn't necessarily an option as yet, but maybe in the future. And awards will be announced, and the project start date for these PPRN demonstration projects will likely be January 2016. And already right now we had 10 PPRNs that were invited to submit applications. So we're really excited about that. So to summarize this, what are the hallmarks of success for phase 1? I think we have highly engaged patients, clinicians, health systems, researchers, and other partners. We have a collaborative community supported by robust governance. We have analysis-ready standardized data with strong privacy protections. We have oversight that protects patients, supports the timely conduct of research, and builds trust in the research enterprise. And we have research that is sustainably integrated into care settings and with communities of patients. But what were our challenges? So again, you can choose a lot of different paths, and I think that these 4 things for me basically sum up. It was a challenge, but in hindsight now, it just gave us more direction, I think. And so establishing a network that is a sustainable national resource while incentivizing participation from member networks is a challenge. And you'll see in my discussion about phase 2 and where we're going, how we tried to kind of bridge the gap there. And I think we're moving in a much better direction. The PPRN and CDRN relationships, again, I alluded to that a little bit. It wasn't for lack of trying or a lack of willingness. It was certainly a time commitment and just trying to figure out how best to interact. And I think as we move forward, as you can see, pSCANNER is one of our most collaborative networks in all of PCORnet, and it's basically trailblazing for a lot of our other networks. And they're learning from what Lucilla's done and her network has done to work with the PPRNs, and I think the PPRNs, vice versa, are also learning from what the CDRNs can do for them. I think a third thing was determining the definition and the timing of research readiness. I used that word before, and again, I'm speaking to PCORnet as a whole, but we are still trying to figure out what does that mean and when will we be there. And then lastly, planning for future independence of PCORI. This leads back to the first comment about sustainability and making sure that we're able to have these networks live a long time without funding from PCORI necessarily. So, well, I said we are in transition. We are building a groundbreaking national resource, and I'm very proud to work with PCORnet and the networks involved in it. So what does that mean for phase 2? So right now, just to kind of, wrap your head around this, this is a $250 million infrastructure investment that we have here. And we now have, as of tomorrow, we will be officially in phase 2. And we added 2 CDRNs and we added 4 PPRNs to the mix. And we also have our coordinating center, which provides technical assistance and logistical assistance. They also existed in phase 1 as well. So this is what I was talking about when I said we'd have sort of a new organizational structure as we move forward that's more about bringing the expertise and the knowledge of the network participants together to make decisions for the network. And we have a PCORnet Council, which essentially will be the new name for our steering committee, although there will be a nominating committee within that, and that has just been finalized. We are currently working on the PCORnet Advisory Group. Rachel Florence is hard at work determining the members for that group. And we've always had an executive committee, but we will now have engagement, data, and research committees. And under those committees will be subcommittees and work groups and things that basically are led and have participants from the network. So, excuse me, on phase 2 also, where do the patients come in? because a lot of people will look at that organizational structure and say, well, why don't you have something specifically for them? Well, it's because they're embedded in it everywhere. They're in the PPRNs and CDRN governance. They're part of the PCORnet Council, and they will have new committees and engagement work groups that fall under that engagement committee. So our resources are shifting a bit, and sometimes it's just transitioning names really, but adding a few more bells and whistles. So we're going to have our governance policies. They're brand new. There's one out now, but there'll be more to come. Our phase 1 work groups, we termed them work groups, but now they'll be transitioning into subcommittees, as I said. Our phase 1 resources were basically on central desktop, and for anyone who's used that, I would expect that you would cheer for the fact that we are moving in another direction, and we're looking at what's called a commons, which will hold phase 1 documents such as PCORnet minimum data standards, previous presentations and webinars, special PPRN workspace and contact lists, and hopefully it'll be quite a bit more user-friendly. So again, in phase 2, how are we going to harness this patient power? Now, we've been talking about a national data infrastructure, a data resource for a while, but I think where we're going is a national patient voice. And so I think phase 2 will accelerate movement from single disease focus to community focus and sharing of knowledge, expertise, and infrastructure, and then participation in key national discussions around research. To that point, we are leveraging a lot of national efforts. PCORI's made significant efforts to collaborate, as I said, with federal agencies working in the space, ASPE, FDA, NIH, CTSAs, and in particular CDC. That's a collaboration I'm leading, and we meet weekly, actually. If people are interested, again, I'll have my email at the end. You can ask me. It's pretty exciting natural experiments network that we're putting together with the CDC and PCORnet networks. Again, for phase 2, obviously we have these natural partners. We had them in phase 1, CTSA, Sentinel, and we're working faster and harder to align as we move forward into phase 2. So again, for me, research readiness for phase 2, and what I'll be looking to see that we're able to accomplish is implementing the building blocks that we spent the last 18 months plus. This will merge into our 3 years in phase 2, that we're harnessing the power of patients and participants to transform and support better research, and that we are able to open PCORnet up for business, so to speak, and that we are scaling the capabilities of the network to support large volumes of studies, not just these demonstration studies. And lastly, I usually always like to end with some quotes from our network participants, because what you hear is usually my impression of how things are going, but I'm kind of a different perspective from those that are in the weeds, and it helps me level set when I hear that they too feel the way I do about this network. You can see CDRN basically said that it created a sense of collaboration. We have a PPRN that said it basically made it truly possible to study millions of patients. Another PPRN said it helped them learn what it means to be a learning health system. And then lastly, the creation of our CDRN and participation in PCORnet has been fundamentally transformative. It has sparked conversation surrounding collaborative research at an unprecedented level and engaged health systems, CEOs, senior leadership, trustees, in ongoing CDRN conversations. So again, there's my email. As I said, this is a lot of information to put in 30 minutes or however long that just took me. If you ever have any questions, you have ideas about research and you don't know where it might fit in PCORI, you want to work with another network and you know they are funded by PCORI, just shoot me an email, and if I don't know the answer, I'll get you one. So it's a pleasure to be here, and thank you, everybody.
We have a few minutes for questions.
Oh, sure.
And I would ask you to repeat the question and
Oh, sure.
so please get started. So Daniela.
Yeah, oh, okay. So Daniela asked that I add some texture to the Natural Experiments Network, which is a collaboration with PCORI and CDC. So basically, they are natural experiments, so observational studies about the impact of policy on diabetes, or impact of research, or yes, I'll just stop there. It gets kind of convoluted because it's not something that PCORI is typically used to doing. So what we have right now is there are, CDC has made their awards. There are 5 from CDC that are funded. 2 of those happen to be PCORnet networks, which are advanced, and a combination of Greater Plains Collaborative and Capricorn, which is our Chicago network. And PCORI had a funding announcement, a limited funding announcement open for only those networks that were not funded by CDC could apply to us. We will award up to 3. So we are in that process now, so I can't really actually talk in detail about that. But when it's all said and done, and we're working through what this is going to look like right now, I have, as I said, weekly meetings with the CDC to determine how we will collaborate, because it's an initiative where we actually are not co-funded. We're separately funded, and so we'll have to work out the management process and things like that, what the advisory groups are going to look like. And I'm not sure if anyone, or Daniela, if you're familiar with NextD, which was the previous 5 years that CDC did this sort of same collaboration. And they took their lessons learned and basically are shooting into a next 5 years. But we haven't really landed quite yet on what that's going to look like, so I can't offer that much detail. But again, it's basically centered around diabetes and natural experiments of health policy impact in that area.
So, thank you, Maryan, for that overview. From someone who comes from the more traditional clinical trials space, how would you explain your concept of what a comparative effectiveness trial is, which we understand is a randomized, maybe placebo-controlled trial of A versus B, or it's actually 2 drugs that are out there being used if it's comparative effectiveness. And then what transforms that from an NIH grant for a typical comparative effectiveness trial to a PCORI?
Okay. So I would say, so basically for clinical trials and comparative effectiveness, how does an NIH clinical trial basically look different from, say, a PCORI version of that same clinical trial? Again, I'm not the program officer for our adaptable trial, but I can speak a little bit to what our goal was there. And basically, as I said, it's the patients being involved every step of the way. So the actual question that they even asked was vetted by patients and clinicians and stakeholders from the start. It wasn't something that just clinicians wanted to do. It didn't come from the top, it came from the bottom up. And then as you work through it and the way that you're going to intervene in the study, they work with patients to figure out, well, is this what you want to know? Is this the outcome you're most concerned about? How will this affect you? Are these the types of questions that you feel will be worth responding to? Will this get through the answers that you need? So I think there's a bit of it's hard to converge in those areas when you have, as I said, sort of top down versus bottom up, because the perspectives are so different. You don't necessarily, the answer is not going to be the answer everybody wants to get, but I think they're complementary in a sense, and I think you could find a way for the types of NIH studies that are out there versus the type of PCORI study, and find a way to gain insight from both in a way that's impactful in my mind.
Hi, I know we just have a couple minutes left. So I'm wondering if you can comment on how you're seeing or hoping there will be synergy between PCORnet and the CTSA program.
Okay, again, this is not something I particularly work on, but I do know that for contracting purposes and IRBs and things of that nature, we are trying to not reinvent the wheel. So I think we're trying to leverage a great deal of the work that's going on or that's been going on with the CTSAs for PCORnet, because I think every one of our networks actually includes a CTSA. So we have groups of people within our networks that are already used to doing work in that area, and will help to again bridge that gap so that we can leverage that work.
Do you have additional funding beyond the what was allocated to PCOR? Like, is there ongoing funding, or are you only spending the interest, or will you get more research money in the future?
Again, this is probably one where they'd pull me off the stage for talking about something like this. I'll say that, as I said, those 3 feeds, fill a trust fund that help fund our research. But to the extent of, sort of the finance issues and all of that, I'm probably not the one to ask. But there is a lot of information on our website. I would be surprised if it was that detailed, but yeah. And again, I could find someone who could answer that question for you.